I have always, since I was like a kid, been just really obsessed with how the brain works. And it's the most complex organ in your body. We're still barely touching the surface of what exactly we know about the brain. And of course, that's the thing that controls us. And putting that medical perspective of just how one brain works is really interesting once you go into the social sciences, because now you're looking at a society. So how do all of these complex organs work together to form a society, which I thought was a really cool way to look at neuroscience for a social population kind of aspect. And with aging, that's the biggest thing going on right now. We're seeing a lot. We have all of the boomers are getting older, and we're just going to have a large population of people who are retired and who are aging longer than history has ever seen before.
Welcome to Public Health Careers. I'm your host, Emory Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. In today's episode, you'll hear more about the social determinants of cognitive aging and the methodologies used to assess these determinants across the Lifecourse. It's her dissertation, how you can utilize a PhD program to get a free master's degree, something that I had no clue existed, as well as learning more about the complexity of outbreak science. If you enjoyed today's content or any other of the episodes, all I ask is that you hit that subscribe button, leave a review, and share it with someone who gets some value from it. This is really the best way to support the show getting out to more people, as well as helping other people navigate and transform their public health careers. So be sure to subscribe, leave a review, and share it with someone. I would greatly, greatly appreciate that. So be sure to do that. Thank you so much. Now enjoy the show.
Hey, this is Ebony Johnson. I'm a social epidemiologist, and you are listening to Public Health Careers.
Today, we have someone passionate about utilizing her expertise in life science, social science, and the humanities to address complex health, policy, and social issues affecting society today. She conferred a joint Bachelor in Public Health and Women's and Gender Studies at Rutgers University. She got a dual Master of Arts in Sociology and Master of Science in Epidemiologic Science at the University of Michigan. And she is a PhD candidate in Sociology at the University of Michigan and an epidemiologist at Emory University. We have Ebony Johnson, PhD candidate. Welcome to the show.
Glad to be here. Thank you for having me.
Truly is my pleasure. I'm always glad to get people with varied perspectives on the show. So this is like many of the other shows, but I'm looking forward to hearing your perspectives. And I think you have like a little bit of a unique take in everything that you're doing. So I'm glad to have you on the show.
Well, I'm excited to get started.
Awesome. So as we get started, how do you identify?
I identify as a woman, as a Black woman specifically.
If
Pronouns are she, her.
As you said earlier, you are a social epidemiologist, and with that, you're in your PhD program, almost finished with it, I believe.
Mm-hmm.
So I wanted to hear more about your perspectives on your primary research focus, which is focused on the social determinants of cognitive aging and the methodologies used to assess these determinants across the life course. So I will let you drop into your expertise and share more about your knowledge and experiences in this.
Yes, so I'm currently doing my PhD in sociology at the University of Michigan. My dissertation is looking at how stress impacts brain health across the life course and who is more susceptible to having stressful life events based on social categorization, and how we can measure all of this using surveys. So looking at just data quality and how we can get the best surveys. And this is my cat, Frank, who decided to join me.
Hey, Frank.
Please. Hi, Frankie. The other one might come into the screen as well. There we
No
go.
worries.
That is what I've been doing all day, every day, and I hope to be finished this fall semester.
Okay, well, we are wishing you from the public health millennial side of things best of luck in getting everything done to be able to finish in the fall semester. I can only imagine how you're feeling on this like last leg of your PhD program.
Whew, it's been a long journey. I am in my 6th year and also dissertating through a pandemic, which is not something I was expecting to do, nor was anyone expecting to go through that. Uh, but especially as an epidemiologist, it was a wild time.
I could only imagine, and I'll ask you a couple more questions about that when we get to your PhD process, in your journey. So, before we get into more of that, like I want to hear just a little bit more about how do you choose this area of study around uh, cognitive aging and understanding stress across the lifespan, and like, was this that you discovered like epigenetics and then you wanted to look backwards, or was it just something that inherently kind of stood out to you as a Black person living in this world?
So I have always, since I was like a kid, been just really obsessed with how the brain works. And it's the most complex organ in your body. We're still barely touching the surface of what exactly we know about the brain. And of course, that's the thing that controls us. And putting that medical perspective of just how one brain works is really interesting once you go into the social sciences, because now you're looking at a society. So how do all of these complex organs work together to form a society, which I thought was a really cool way to look at neuroscience for a social population kind of aspect. And with aging, that's the biggest thing going on right now. We're seeing a lot. We have all of the boomers are getting older, and we're just going to have a large population of people who are retired and who are aging longer than history has ever seen before. We're living longer. We have all of these medical advancements. So we're seeing a lot of new brain related degenerative conditions that we've never really had to deal with before. So, looking at these things together was a large part of what my advisor was doing. So, I kind of came in looking at the demography aspects of aging and how aging has, as far as cognitive health, has disparities based on stress levels, which of course we all know that people are stressed out in different ways. I mean, as a Black person, I have differential stress than a white person. As a woman, I have differential stress than a man, just based on how our communities are just looked at in society. And all of these things come together, and we see just differential stress processes based on social stratification that impacts health across the life course. And then we're seeing all of this aging related research. So all of that came together to essentially inform my dissertation. And then me and my advisor really wanted to look at the survey methods on how we even uh, look at stress, which is a large part of sociology literature. Uh, so, sociology of health does a lot of things on the social stratification of stress processes, and it does a lot of survey research based on that as well. But how well can we actually look at that on a quantitative level? What are the gaps that we're seeing? So one of the things that I'm trying to look at is, are there socio-demographic bases of responses, or how people actually remember their lives? Because a lot of these things are uh, longitudinal, or they might be retrospective. So, what's the difference on based on memory of how people actually talk to uh, or put in the surveys, whether it's talking to a interviewer or going through a computer. So maybe black women remember their lives differently than a black man or a white woman or a white man. And how does this impact our survey results and data quality?
Yeah, I appreciate that, and I always know I'm talking to someone who has like a background in sociology when they talk about like demography and stratification, because
Yes,
you
very.
you hear it sometimes in like public health specific, but like I think when you have like that rooting and that foundation of sociology, which I think is like a foundation of public health, and well, I would say it is a foundation of public. I don't think,
Definitely.
um, but yeah, you definitely hear that demography type of language a lot more, and that's quite interesting to think about. I think the first thing is like how to look at stress. How are we collecting this data on stress? What how can we create better ways to collect this data around stress, as well as understanding that we are in an aging population, and that comes with new challenges that we have to think about as a society. So there's a lot to come in there. So I appreciate you sharing a little bit about that, and maybe we'll talk a little bit more about that later on when we get more into your PhD program. But before we get into your beginning into collegiate career, I wanted to ask, what does public health mean to you?
Public health means to me being a medical doctor for a whole population. And that population could be as small as, a few people in a community or an entire country. And just being able to see the best outcomes for those people that you care about.
Love that. Love that. I would shift it around, but I guess in my perspective, I'm like medical doctors or public health people that try to treat individual patients or clients or populations. But
Mhm.
that in itself has some issues in it because we know that the
Oh,
medical
yeah.
system isn't so much focused on that prevention side of things. But we try
Not
to
at
get
all.
them there. We try to
We're
get them
trying.
there.
I think it's getting a lot better.
Right, right. Slowly but surely, slowly but surely. But yeah, and I think that's like a useful way for people to think about it, because many times we find out about public health and we have no idea what this means or how to relate it. So talking about it in
That was
a
me.
in
When I
right.
first heard of it, I was like, "What is this?"
Right, right. So talking about it in a perspective that we kind of like just understand as society, I think is very helpful in giving us that framework. And in you saying that you got your bachelor's in public health as well as women's and gender studies at Rutgers University. What was the thought process of this degree? Did you going in there knowing public health? How did all of that unfold?
Oh, not at all. I went in there as a neuroscience major, and by my second year, I knew that this just wasn't for me. I wasn't good with the way at least the biology courses were taught. I'm not
Mhm.
sure if however they're taught anywhere, it still might not have worked for me, but I just could not get my head around just the biology part. All the memorization, it just didn't work with how my brain works. And I was getting by, C's get degrees type of thing. And I was complaining to one of my coworkers at the time about, just my feelings around this. I knew I wanted to go into a brain science sort of career, and I thought that, neuroscience was the only way. And but it just wasn't working. And she told me that she was a year above me, and she was telling me how she had a similar situation, but we both had the problem that we had all of these science credits, and we didn't want to transfer into another major that wouldn't take it, and then our time would just be extended being in undergrad. But I think maybe a year or 2 years before I came in, they created this public health undergraduate major. They always had the graduate school, but now they had this undergraduate major, and it took all of the science classes that we had already taken. So she was like, "How about you like try out a class or two of that?" And see how that works for you, because that's what she did, and she ended up transferring into the major. So I took the class. I took Intro to Public Health and Public Health Policy and Planning, which was a joint between the Public Policy School and the Urban Planning School. Those were the two introductory classes that you needed to take anyway. And I fell in love with it. I thought, oh, this is perfect. It's all the sciencey things that I love, plus all the social things that I love, plus math and statistics. It's just like a hodgepodge of all of these different things. And I saw that there's a broad amount of careers that you could do with this major. And that's what I did and kept going with it.
Love it, love it, love it. And how did the woman and gender studies parts of it come into there? But and before you answer that, like I think it's just so important, as you said, you had this friend who was a year ahead, who was in a similar situation as to you, and you were able to have a conversation with them and get a better understanding of, okay, this science-based neuroscience stuff isn't working for like how I learn and how I want to be effective in this role. What are other things that are sort of related to that? And I think it kind of like speaks to you in your PhD right now, because you are doing work around neuroscience. And it's important to highlight that there's just so many different ways to get to doing work in a
Uh,
specific field,
exactly.
right? So that's just important for people to think about out there. But going back to the question, so women and gender studies, how did that come into the picture?
So that was kind of a similar situation of I just fell into it. My coworker was telling me about this class that her friend took. It was a Woman Studies 101 class. And she was like, she said it was real. Her friend said it was really fun and it fulfilled a requirement that we needed to graduate anyway. So, would you like to take the class with me? Because we had an opening in our schedule at the same time. And I was like, sure, why not? A fun class that fulfills a requirement. And I go in there and it's just, I took the class and it was just so eye-opening, and the teacher was amazing and I loved it. Never really thought I was going to do anything past that, but fun fact, I actually failed my chem lab that year and my GPA went down so much that I had to take a summer class to get it back up to keep my scholarship. So for all of those folks out there who think that their first and second years aren't going too good and you won't make it, I promise you're all right. But I had to take a summer class and they had a list of all these classes you could take, and I was like, let me just take the most interesting one. I mean, I only needed to just bring my GPA up. So one that I saw was what was it called, Women in Music, I believe it was, something like that. And I took that course and loved that as well. Um, Especially since when I wanted to first go into neuroscience, I really enjoyed research on stroke patients and how they used music therapy in order to get them to speak again. So I also studied a lot about music and music therapy as well. So I thought that this class was, great. And once I took that class, I was like, you know what? Maybe I should just turn this into a second major. I already took 2 classes on it and I really enjoy it. And I could focus my public health on women's health. And that's essentially what I did.
Yeah, I appreciate that, and I appreciate the words of encouragement to everyone out there. That just because things aren't looking good right now, it doesn't mean that they aren't going to work out in your favor and work out well for you. Because yeah, I've been in that similar circumstance where you feel in organic chemistry class, but hey, you get through it eventually and get to where you need to be. All right. So during your bachelor's program, you had a few positions that I'll mention, and then you can talk briefly about them. So you were a peer mental health educator at Rutgers Health Outreach Promotion and Education, a senior manager at Rutgers University Student Center, as well as a public policy intern and outreach worker and peer health educator at Hyacinth
I did
AIDS
a lot.
Foundation. Yeah. So tell us briefly about those experiences.
Yeah, so I mean, the public health related ones, I was a peer mental health educator. That was through the Rutgers Health Services division, and we would just host workshops around campus on student mental health based on test anxiety, leaving home, and just pretty much anything that students tended to just feel stress about. And this was really at a time where mental health was just starting to be like fully talked about. So it's been interesting to see how much of a forefront that has come. I remember talking to student groups who just knew nothing about how to take care of their mental health. They knew all the things of how to go to the doctor. You know, you have a broken arm, you go to the doctor, get a cast, all of that. But when it came to their mental health, they're just like, I don't even know what this is, but I'm going to push through it. And I was able to just give people advice and show them the services that the school had, where I could say, you know, you don't have to be so stressed like this. You don't have to be as depressed as you're feeling right now. And what you are feeling may be depression, because a lot of people at that time just didn't know the symptoms of these things that we had treatments for. So that was a really interesting position. And then as an internship, I worked at the Hyacinth AIDS Foundation. I worked there for 2 semesters and then was hired there after I graduated. And for the first semester that I worked there, I was a health education intern, and I taught classes all around the county on sex education for HIV reduction. And that was really interesting just to see how, you know, a lot of purity laws and zero abstinence laws came into play of where we could do these workshops and where we couldn't, because I was based in New Brunswick, New Jersey. That's where the nonprofit was that I was working at, and we couldn't do any workshops in our county because they had a zero tolerance of sex education. It was like abstinence only. And it was so strange to me. I didn't even know that that was possible to
Mhm.
have on a county level or on a city level, sorry. But yeah, it was strange, but I really enjoyed doing that work. We worked with teen women and non-binary, or teen girls and non-binary children, and it was it was a great time. I enjoyed working with kids. And then for my second semester, I did a public policy internship at the same place. It was just in two different departments. And with that, I taught people how to actually talk to their legislators on HIV policy. So we talked about medications and budgets and appropriations and syringe services. And that was just a really interesting, because I never had any, policy government experience. I barely knew how, you know, any any law got passed. I was just in the wind about it. And it was in our cultivating, we would host these workshops for people to learn all of these things. And our cultivating project was to actually go to Capitol Hill and talk to our legislators about these policies together. So that was really cool to be able to do that, especially as an intern and leading all of these grown folks around the Capitol. Um, so yeah, and then I just worked as at the student center for work study. But that is where I had my coworker who taught me about public health. So that that ended up well, because now I'm here.
Yeah, absolutely. That's great to hear, and thank you for sharing those experiences that you had there. And well, I guess I'll ask you this in a second. But did you have any big undergrad takeaways from your experience in your bachelor's program?
That's a good question. Definitely one thing I wish I did more as an undergrad is use the resources that the campus had and actually look into them. I wish I went to office hours more. I wish I went to the tutoring services more, and as well just talk to other people about their majors and what they were doing and seeing all of the things that I could get myself into.
Yeah, fair enough. Definitely those opportunity costs that we do sometimes just not get, or just being a little naive and
Mhm.
not using the resources that are there, but just trying to do it by ourselves as we get into
Yeah.
these
But I
adult
mean, as
phases of
a
life.
first gen student, you don't really know. So that's also just a setback that was put upon me, I guess I should say.
So after you graduated, you said that you worked for the Hyacinth AIDS Foundation for a little bit longer, as well as I see that you were an Afro academic, cultural, technological, and scientific Olympics volunteer mentor. So
It's
talk a
a
little bit about
mouthful.
those positions. It is a mouthful, that is for sure.
So after I graduated, I got hired by that same place that I had my internship, and I was doing essentially the same work as a health educator, but I was doing this for women ages 18 and over, and just doing sexual health education classes, mainly for women who were already living with HIV. And that was really eye-opening, especially at I was still in my early 20s, and I was teaching women who were like in their 50s sex education, but realizing also just how much knowledge was kept from them all of their lives about sex education, and how, you know, that we still have that zero tolerance for the education and abstinence only mindset, and
Mhm.
trying to get people out of that in the most scientific and socially acceptable way. Um, and then also learning about, grant writing, since this was a nonprofit, and data generation and evaluation and monitoring of these programs that we were doing, which was all very new to me, and I learned a lot and have kept that, of course, going forward. I mean, grant writing and monitoring will never go out of style, unfortunately.
Right.
And at that same time, so I was in a new city doing this work. I was working for the same company, but at one of their other locations. So I wanted to get a bit involved with the community so I can just feel at home. So I looked for some, science mentorship things, because I miss working with teens at that time. And I found that the NAACP had essentially a science, uh, it was science and arts Olympics. And one of their things was, biomedical science. So I volunteered for that for the summer, and was a mentor to two or three students, just on their project for this competition that they had, which was really interesting. And I got to talk to these students and help them with their careers and show them all of the things that I had just learned leaving college. So that was great. I got to meet a lot of new people, and I'm glad I just had that volunteering experience, even if it was only for a summer.
It's important that you highlight that people that could be 50 years old don't have sex education, because, like, to your point, they were never those spaces for them to talk about it. And in a lot of spaces, it's like you're not to your point, it's like going to be abstinence, or you're just not going to know, have that knowledge. So I think it's really something that we should be mindful of as public health
Oh,
professionals going through this
absolutely.
world. Is like not assuming that just because someone is older and they have this more life experience that they have this education around this topic, because many times it just wasn't something that was available for them to learn about. So that's really cool. And
Yeah,
as
we
well
need
as
much more sex education in the nursing homes. The STD rates in nursing homes will blow your mind.
I, I've definitely seen some stats and heard some interesting stories. That definitely makes sense, especially with the more aging population that's going on there as
Mhm.
well. And I also like that you highlight like you enjoyed working with children, so you seeked out a way to do that, like outside of your regular job, becoming a volunteer and being able to interact with them and like give that experience and those like knowledge and different things that you learned and imparted onto them, which I think is important.
Yeah, it was a great time.
Nice. And then after this, you were a project management support specialist for the oncology medical imaging at Bioclinica. So talk more about that experience.
Oof, you reading all of my resume back to me. I'm like, I've had a lot of jobs. So my position at the Hyacinth AIDS Foundation was a temporary position. It was just for the summer, just working on a specific project. And I was thankful that my boss was able to get that to me so I could just have something stable after I graduated while I looked for something else. And I found something else at a company called Bioclinica. It was a clinical research organization, and what I did was essentially project management for cancer clinical trials. And I learned a lot about the clinical trial process, which was very, very new to me. Um, very, they're very expensive and they take a very long time. So I feel like out of maybe the 10 to 15 projects I worked on, I only saw one actually end. Um, but that was a good time. I learned a lot about medical imaging and how all that works. So, all the medical physics things, which is another field that I still have like no idea of the intricacies that goes into it. It's so interesting to me. Um, and yeah, just learning about clinical trials and how we actually get those off the ground, these multi-million dollar things that take forever that eventually change the world.
Yeah. Okay. That's cool that you had like a shift into this clinical diversity part of things. And once again, I think the more that we get into different positions and learn about things is sometimes the same point in time where we're like, oh, there's so much in this nuanced field that I don't really get and I don't really understand. And I think it's good to hear people say that and just acknowledge it, because it is something. And I think that like imposter syndrome might come in and you're
Mhm.
thinking about, okay, how did I get this position? I have no clue what's going on, but you're like doing it day to day and stuff like that.
Seriously.
And after this position, you decided to get a Master's of Arts in Sociology. And I don't know if it was you applied for a PhD program that you had to do sociology to then get into the PhD sociology program. And then I think also during the time when you were getting the Masters of Arts in Sociology, you decided to get a Masters of Arts in Epidemiologic Science. And all of these were from the University of Michigan, which you currently are a PhD candidate in sociology at the University of Michigan, as well as before this show, you said that you're doing all of this online. So tell us about that progression in your career to decide to go for these master's degrees, and what was your thought process there?
So actually, I went for the PhD first. So I started the PhD program in 2017. And after my first year, I added on the Master's of Epidemiology. For those who don't know, if you start a PhD program, most likely if you added another degree, it's all free. You don't have to pay for it, which was great. Once I found that out, I was like, oh, definitely. I will definitely be adding something to this and stressing myself out. And since I was already in the PhD program for sociology, once I finished all of my courses for that and finished all of my competency exams, I was automatically conferred a master's in sociology. So now that I'm a candidate, I'm just doing the PhD part. But all of this was in person. I was living in Ann Arbor, Michigan. Um, and once I finally finished all my classes and candidacy exams, that's when, all of my dissertation writing was online and I could leave. I was like, I need more sun. There's way too much snow here. I'm used to snow, but not like that.
Okay, that's fair enough, and that is good knowledge to know for anyone that is thinking about doing a PhD program or going into a PhD program. That many times you can get that master's or that additional degree for free. So, was it that you were doing this to like build out a greater skill set, or was it just that you realized that you can do it and epidemiology was something that you wanted to learn, or what was that thought process for going from like getting that master's of science in epidemiologic science?
So when I was in undergrad, I originally wanted to go straight into getting my MPH in. I wanted to do it in health policy because I didn't feel like, as much as I really enjoyed the epidemiology class that I had and would have loved to go into that, I didn't feel like I had the math and stats background that I would need to actually get accepted. So I was going to go into health policy instead, which was something I also enjoyed while I was being a public policy intern. And I was talking to my advisor then for when I took so when I was in my women's and gender studies program, I had to write a culminating undergrad thesis. So one of my advisors for that was in the public health department, but she had her master's in epi and then her PhD in sociology. So she was telling me about how she essentially did that process and got her PhD in sociology and added on the master's in epi and showing me because I ultimately wanted to be a professor at that time. My mind has changed since then, but she was like, "So you don't have to, pay for this master's and then go into a PhD program. You can just go straight into a PhD program in sociology, unlike what you can do in public health, and then add on the master's as you're there." And I thought, oh, that's a great idea because ultimately I wanted to be a professor anyway, so I wouldn't have just stopped at the MPH. And she told me like you can still do health research. You can essentially do all the same research that you would want to do. It would just be more theory focused, which was fine with me. And yeah, I just followed her advice. And once I got into Michigan, I realized my advisor, who I was assigned then, also did the same thing that my undergrad advisor did, which was go into a sociology PhD program and get the master's in epi along the way. So I feel like I'm just following the dreams of the other people who have advised me. And then once I started my epidemiology master's, my advisor for there, she didn't even have a degree in epidemiology. She only had her PhD in sociology, but her stuff was so epi focused essentially that an epi department still hired her. So all of these things kind of culminated together.
No, that makes sense, and I feel like that is very strategic in some ways. And I've heard quite a few times from people like, yes, getting like a master's in epidemiology, a master's in public health, and a PhD in sociology like allows you to better apply the things that you learn in public health to
Oh,
like
definitely.
the demography, as a sociologist would say, and the population dynamics that happen within that. So that makes sense. And what was that thought process for you? Because you said that you wanted to be a professor, and that is not the case anymore. What was that thought process that changed that for you?
I realized once I was around professors more intimately as a graduate student, I think I realized that that's just not what I wanted to do. As far as just being within the university system, just as a professor, it just once I realized actually what the job entailed, unlike how I saw it as an undergrad, I realized that's just not the path that I wanted to go on. But I still enjoy doing research. I still enjoy teaching. And once I got into that graduate program, I saw all of the ways that I could still do these things outside of academia that I had no idea about beforehand.
You live and you learn, right? You live and you learn.
Exactly.
Yeah, absolutely. And I love that, because I think, like, to that point, is like many times we just think we want to do something because that's what we see, but then as we develop and learn along our path, we're like, oh well, I like this part of it, but I don't like the occupation of it per se. How can I figure out ways to do that? And one thing that I love about like public health field is that, like, there's so many ways for you to understand and develop that, and build it out for yourself to see if the kind of work that you want to do. So I appreciate that. Looking back, given that you are going to complete your PhD program in the fall, God willing, what would you repeat the same process that you've done, like going for the PhD in sociology, while then you get Masters of Arts in sociology, as well as the Masters of Science in epidemiologic science? Do you think that was beneficial for you looking back on it now?
Oh, absolutely. I really enjoy being able to have the quantitative and more methodology focused skill set of epidemiology while also having a theoretical background and expertise of sociology and being able to put these things together. And they just complement each other very well, which surprises a lot of people. Even other epidemiologists I meet, they're like, "What does sociology have to do with it?" I'm like, "Everything." um, but yeah, I think I'm glad that I was given the idea, and I would definitely repeat it again.
Yeah, good insights for people that might be thinking about a similar path. So I appreciate you sharing that. And during your time, I'm not sure when in your journey. Well, I'm guessing all of these different rules that I'm going to go over now are while you were at University of Michigan. So you were graduate researcher and sociologic research methods graduate student instructor at the University of Michigan. You want to talk a little bit about that experience?
Yeah, so I was a GSI for 2 semesters teaching sociological research methods. So I taught about both quantitative and qualitative methods, and my epi background definitely helped out a lot with that. I was also taking the classes in epi at that time as I was teaching. So a lot of the things that I was learning in epi, I was able to transfer into these research methods classes that I was teaching. And what I had to do with the students is help them create their own research project. And this was probably the first research project that any of them have ever done, which was, it was really exciting to see the concepts that they came up with and how they actually were able to execute all of the things that I was teaching them. Um, but research methods I think it was more complex than a lot of the students realized. I think they all just thought, well, you just learn how to do stats, or you just go and interview somebody and then you're done. And you just write it all up. And it's like, no, there's a lot of theory behind it. You have to learn about bias and all of these other things. And it was also eye-opening for me. I think I learned a lot about research methods that I wouldn't have really paid much attention to before, that became very necessary as I was going forward with my PhD.
Okay, that makes sense, and I can imagine how happy it feels to be able to support someone in doing their first research, and even though that they probably think it's a lot more simplistic than it really is, and I guess to that point you probably are supporting more than you might have wanted to at that point in time, but you get to see that growth of students
Lots
and
of
see them
office
learn.
hours.
Right. And then you're also a project manager at the University of Michigan School of Environment and Sustainability. So talk more about that experience.
Yeah, so that was a really fun time. I had a friend who was also in the epidemiology program with me. She was doing focus on environmental epidemiology, and she was also joined with the School of Environment and Sustainability as doing a joint environmental justice master's program. And she, for her cultivating a master's project, she was doing some work in Uganda on waterborne infectious disease and the social aspects around that. And so she was recruiting people for this team because she was able to get some money to actually form a team and complete the project. And since she knew that I had, a sociology background as well as an epi background now, she asked me to, help her out as the project manager on this team. And I was like, sure, free trip to Uganda, of course. School paid for it, absolutely. And it was really interesting. Just this was my first global health project I had ever worked on. So it was really interesting to be able to use all of my knowledge in trying to figure out how does this work on a global scale, especially in a country that I have never even been close to. And I worked with a multidisciplinary team. So we had business majors, we had biologists, policy majors, all on this team trying to figure out the best way to make this project cultivate. Unfortunately, we never got to finish it because 2020 happened, and the project was just essentially canceled because we weren't sure when we would be able to travel back to our study site again. But overall, being able to work with that interdisciplinary team, especially working with another team that was based in Uganda and learning about just global health in general, uh, was amazing. And I'm so glad I was able to have that opportunity.
That sounds like an amazing opportunity, and I'm sorry that it had to end early. I think the highlight there that I want to point out to people that are listening slash watching is just that, like, the intersections of your knowledge and your skill sets made you the perfect person for your friend to ask you to be the project manager, because you had those differing skill sets that come together to support the work in a holistic way, which I think is just something that we need to think about as we're continuing to build skill sets as public health professionals in this world.
Absolutely.
Yeah. And you're also a program assistant at the Ginsberg Center for Community Service and Learning, as well as an instructional design services consultant at Rutgers University. You know, talk about those two experiences.
Yeah, so those were essentially just two parts of the same job. And what I was doing, I was a program assistant for our center on campus that dealt fully with just how the university works with the community that it serves. So essentially, any community in Michigan that the students would be working with for community service events for maybe like a sorority or fraternity or just a community research based class. And we created workshops through this center on how to do this equitably and how to teach the students and even staff on how to go into communities in the best way possible in order to not let any type of power dynamic that we have as university employees and students overpower what the community actually needs. So we had extensive workshops. A lot of times they were tailored to specific disciplines. So, for example, a lot of our talks with the engineering department had to do with implementing, like, maybe a medical device into a community and how to best do interviews with the community on how their device works, what type of things could go wrong, and stuff like that. And that was really eye opening for me just to see, one, how communities do interact with, or how universities do interact with the communities that they serve. and two, how unequitable that could be. I think we know, especially as Black people, how research can be done very poorly with certain populations. And being able to teach others about that and the history of that and the theories of uh, community engaged participatory research was really, it warms my heart just knowing that we can get better at this.
Very important work, because many times, as you said, like universities can be very extractive of communities and not work in a mutually beneficial way.
Yeah.
And I think that's why we need to have positions like these where people are trained in understanding, okay, no, that doesn't sound very equitable. We can't go to the community and do that kind of work. Or like just being able to have that person that says, why don't we think about it this way? Or like, why
Mhm.
don't you approach it this way? Why don't you try to build that relationship before you ask for grant funding to go work with this community? Because
That was
that
a
is
good
something that I hear a lot of. It's like people they see in research that there's this one zip code, this one community that has the worst health outcomes, and they have no connections to the community and no partnerships, but they still put them in the grant to do work, and then it's like an afterthought of like building that
yeah.
connection and that relationship. And like as you said, with Black communities, indigenous communities as well, there has been historical marginalizations and extraction of information and extortion in many cases. So there are historical reasons for why communities can be hesitant to work with universities. But going back to my point, like, glad that there are these types of positions, and I hope that there are more of these types of positions and more models that are out
I
there,
hope
so that
so.
people can work with communities equitably, so that it is a mutually beneficial relationship for both of them.
Absolutely. Absolutely. It blew my mind, some of the things that I heard from community members.
Yeah, I could only imagine, because yeah, that a lot of those conversations that I have with community members that I work with, it is around working with universities and health systems. How can we show them what we want from this? Not so much like them coming in and telling us what you're going to get, but hey, this is how, if you want to come and work with us, this is how you work with us. And I
Yeah.
think that is very, very important in this type of work. So I'm glad that you're able to do that. And you were also an outbreak science consultant at Broad Institute of MIT and Harvard. So tell us a little about how you got that position, and then what did you do in it?
Yeah. So I was a consultant for them. They were working on a textbook about outbreak science, and they had a chapter on the social drivers of infectious disease. And I was working on with them on another project. So this is how I we essentially worked out that I would consult them on this textbook chapter and just essentially showing them what are some things that they could include, some things they may want to take out, and how to make it more essentially approachable, I guess, for multiple communities. So that was fun. That was one of my first consulting roles. But the other project I had worked on with them, I was also an outbreak science consultant, and it was with a company called Complexly. And I was working on their crash course YouTube series on outbreak science. And I came across that because they had put out a video in 2020 just on COVID and public health. And I thought the video was really good, the YouTube video. And I thought, well, if they're doing this, I wonder if they have like any open positions for public health researchers to do, a more extended YouTube series. And I looked on their website and they did. So I applied and was selected for the role as a consultant. And I essentially created the curriculum guide and an episode list for them as far as what they would be doing for the entire series, and worked with the script writers and all the animation studios, and was able to cultivate this. I believe it's like 15 episodes, I want to say, just all about outbreak science as a field. And that was really fun. That was my first ever science communication type of job, and being able to put it on this large platform and put it on YouTube. It was really great.
That sounds phenomenal, and I think that's cool in the sense that, hey, you saw like this video that would like was relatable to you, and you thought they did a good job. From that, reaching out and going to their website and seeing what they had available, and then being able to fall into that role and like kind of design and show and share with them what were those important topics that they should be covering in the series. And I will definitely link once it's available on YouTube. I will link that in the show notes for anyone
It's
that
already
is interested.
available, so.
Awesome. And I think that just it just kind of highlights more of, you know, you don't always have to be tied down to the specific box, because as you said, you'll be able to build out that epidemiology communication skill, so that the communication skill set, which I think is something that is also kind of lacking in the public health field, but just being able to interact with all those people in that space is cool. Yeah. And before I get to your current positions, which you have 3 of them, you said earlier that you had to do your dissertation online, and that was a struggle in itself. Do you want to talk a little bit about that process and like how you got through that and how you are getting through that currently?
Yeah, I mean, I think many doctoral students can relate to this, but going from having such a structured life with classes, and then, you have your competency exams, so then you have a structured summer, and then you finally get through all of that, you're a candidate, and now you just have to work on a dissertation. Some people are doing field work, they might be in completely other countries, and you're just left to your own devices. It's like you make your own schedule, you set your own deadlines, and everything about finishing this dissertation is now up to you. And it's a lot of pressure. It's very new for a lot of people, especially someone like me who always has a job. And reached candidacy in 2020. So it was like, well, now everything is online. So it was one, figuring out how to do this dissertation in a way that I haven't done before and navigate this new life that we're all living. And it was a strange time. And I guess this will go a bit into what I just finished doing as far as work. In 2021, I felt like I just was tired of sitting at home. I was tired of not having structure. So I wanted to just essentially apply for another like research position or something kind of part-time where I could just structure my day a little bit more. And I ended up seeing this fellowship at Emory University that they had just created that targeted, COVID-19 epidemiology. And one of the things that they were doing was partnering with local health departments and using the university resources to help them out. And I thought that was a great culmination of what I was doing as far as doing the community research workshops beforehand, as well as just wanting to get out the house essentially and use my epidemiology degree that I just got for good during a pandemic. And I was able to get that fellowship. It was a 2-year full-time fellowship. I was working in a county health department. So I was working at the Fulton County Board of Health that covered all of Metro Atlanta. And I was doing COVID-19 investigations for schools and workplaces all throughout Atlanta. And that just ended literally last week. So I completed my 2-year fellowship. And I learned a lot. I learned so much in these past 2 years. Actually, my first year was focused on infectious disease as far as COVID. But once that started to die down a bit, I kind of wanted to branch out, and I started doing opioid overdose and substance use epidemiology work, which overdoses also increased during the pandemic. So that was a large area that people were doing research in.
That sounds awesome, and I can imagine that everyone was studying and doing work around COVID during the pandemic.
Oh yeah.
But but I'm glad that you're also able to switch across to a different topic. And did you want to highlight maybe one or two main takeaways from this fellowship program?
Yeah. One is that local health departments do everything. They do so many things that you just wouldn't even think of. And there's so many roles in public health through them. Environmental health, you have sexual health departments, epidemiology, everything. And I think they just don't get as much attention as these federal services such as the CDC and NIH and FDA, and they really should because they do a lot of good work. Another thing is we need better funding for them. We need better retention strategies for their workers because they're not getting this respect that I believe that they deserve. They're also not getting the funding that they deserve. And that hurts a lot of the local communities because they're not able to do the jobs that they would like to do. And the staff, they work so hard for, hate to say it, but little pay compared to what they definitely should be making because they do so much good work. And I think it was a very rewarding 2 years, and I really learned a lot about one, how government works, and two, how epidemiology works in local government.
Yeah, well, thank you for highlighting that, and I definitely believe that to be the case, and it just shows just like that society doesn't value public health as much as it should,
No, it does
and
not.
and unfortunately, the ramifications of that mightn't be seen now, but there are ever growing issues and challenges that are coming up in society that, if they were properly, sustainably funded local public health, just how much improvements that could be made to our population's health. And I'm glad that you're an advocate and highlighting that because, yeah, something definitely needs to change
Mhm.
in order to get a better local public health system. And I know like local public health is different state by state, for example, but just generally, broadly speaking, we know that they are under resourced, underfunded, underappreciated in so many ways,
Absolutely.
and under capacity as well. Many people are working several roles
Mhm.
and not getting paid enough for those many roles that they are doing.
Oh, absolutely. I mean, you hit the nail on the head. it's
Yeah.
it's we need to invest so much more into our public health, and hopefully after 2020 happened and this whole pandemic, and with monkeypox, because that was another big one that I was also helping on, hopefully we have shown the public how important this field is.
Yep, absolutely. So shout out to all you local public health people
Yeah,
listening to
shout out
this
to
or those
all of
interested
you.
in it. Yeah, we appreciate you all. So I think you covered most of the rules that I was going to cover before we got into talking about your dissertation and the challenges of that being online. But you also have a role. You have a role as a chief operating officer at STEMulation Escape Room, which sounds like a pretty fun activity. I'm guessing it is. But tell me more about that.
So during the pandemic, 2020, the summer, me and all of my grad student friends who were stuck in Ann Arbor, uh, stuck in our homes. We just wanted a project to do that wasn't our dissertation. So one of my friends, she had a budding idea for, just STEM related educational games that focus solely on Black children and Black culture. And through that, we ended up creating these essentially escape rooms in a box. And it's all focused on Afrofuturism and using STEM education to try and figure out these puzzles for the game. And what I did, since I had a project management background from working at Bioclinica on those clinical trials, I was like, well, I can just do the operations portions of things because I like to do that anyway. And we just got the ball rolling off an idea with a bunch of bored grad students stuck in Ann Arbor. And it was really great. We were able to, recruit other friends who we knew would be good for other roles, and created this company. And we were able to, win an award with the University of Michigan to focus our game on trying to be more VR based eventually. And unfortunately, we got a little busy with life, so things have died down, but we're doing a lot of educational consulting on the side with our company and being able to just do curriculum development that is socially conscious and recognizes the inputs of marginalized communities has been really rewarding with that as well. And no, now I can say I am a game designer as well as a sociologist and epidemiologist.
It's cool to see what board grad students can come together and do and create.
Yeah, having a
And
bunch of curious people stuck at home is an idea generator.
right. So tell me more about what does I think you said socially responsible curriculum design. What does that look like?
Yeah, so a lot of curriculums, especially for STEM education, it's just based on white men and just seeing the world as essentially black and white. Like, this is math, this is how you do math. 2 + 2 = 4. That's the same for everyone. That's the same in every community, and kind of just looking at it like that. Whereas when you're doing socially conscious education, you realize math is not the same for everyone everywhere. It's not used the same. Math can be used in a destructive manner, and this goes for science, engineering, and tech, all of these things. But I'm just going to use math as an example. So math can be used to, show the trajectory of drones to bomb somewhere. Like, math is not an objective science because people are using it and people are not objective. And how math may be used in the US may be different than how math is used somewhere else. We're a capitalistic society, so our math is a lot of times based on money and based on finances, whereas somewhere else it might just be based on something completely different. Who knows? But it's not objective, and we definitely need to add that aspect into our curriculum, that the things that we do with science, with engineering, with tech, with math are based, they don't exist in a vacuum, essentially. And I think we're learning that a lot more, uh, especially with AI. We're seeing all of this policy around it, how it can be used for good and used for bad. And these are just the things that I think we're finally starting to understand as a society.
Yeah, I like that. I like the perspective, and definitely is interesting to think about the objectivity or subjectivity of these things that we think are like binary in the way that we think of them, but there are a lot of nuance when it does relate to certain situations. So that's really cool as well.
Yeah, it's been an interesting journey learning about that from a lot of science educators and math educators that we had on our team.
Yeah, absolutely. Okay, so you're coming to the end of your PhD run, and I wanted to just ask, and I guess you kind of alluded to this a little bit earlier on, but where would you like to see yourself going into the future?
I would love to see myself doing more research outside of academia, most likely, but I never know where my life goes. But hopefully, just doing more research on health equity and looking at just how we can make aging more, how we can have less disparities in healthy aging. and creating less stressful lives for people. Not sure how I'm going to do that, but I'm going to do it. I believe in myself.
Yeah,
But
we
yeah,
believe in you too.
thank you.
And
But yeah,
you're welcome. And
I think I fell out of love with research for a while during this PhD process, because once you're doing something all day in and out, especially for a PhD, you start to hate it. But once I became an epidemiologist for the Fulton County Board of Health and doing applied epi, I realized how much just the research part of things really mattered. And I realized that that is something that I really enjoy doing. So I look forward to continuing my journey with that.
awesome. Well, we look forward to seeing how that unfolds for you. I know that you have a lot of intersections in the knowledge and the experiences that you have, and it's going to culminate into something special. So we look forward to that.
I know too. Thank you.
Good, good, good. Okay, and moving on to the the five question that I ask all
Ooh,
guests.
furious. All right, I'm ready.
Number one, what advice would you give to a student trying to pursue a career in public health?
Definitely explore all your options. It's such a broad field, and I mean, people tend to fall into different things, especially in this, because our skills are so transferable. But figure out, or not even figure out, just try out a lot of things. Try out a little bit of epi, a little bit of stats, a little bit of qualitative work, um, and just expand your skill set, because it's very easy to do in this field.
Love that. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Ooh, getting into a PhD program. Definitely talk to professors and talk to other PhD students. If you just send a PhD student an email, more than likely they will email you back and just give you all the tea that you need for that program. And we love talking to people, especially ask us about our research and we won't shut up. um, and definitely just make sure you really research the program that you're getting into and make sure that you like it. Don't focus on whether they would like you.
Love that. Great, great advice. Number three, what's something you're working on improving in your life right now?
Currently, time management. Now that my fellowship is over and I no longer have structure again, I have to relearn this thing. And while I love having more free time, especially to work on my dissertation, I haven't had to do this time management thing in about 2 years. So relearning that.
Understandable, understandable. Well, you'll get through it. Number four, professionally, do you recommend anything?
That's a good question. Professionally, I recommend networking. I think it's always emphasized, but I don't think people realize how important it is. Most jobs are uh, found through networking. And I think that's something that I really discovered the importance of very recently, because I'm very introverted. So I have to put a lot of effort into networking, but I've made a lot of good connections with people and a lot of good friendships that I wouldn't have expected through actually doing this networking, going to conferences and just going to their networking events, or seeing if there are things happening in your city, seeing what things are happening on campus, or creating your own networking events and maybe just bringing a bunch of friends together and seeing what happens.
Yeah, love that, and very, very important. And yeah, there are definitely different ways to do it as an introvert, extrovert, but definitely have to get out there. And
Yes.
last but not least, where can people connect with you, Ebony?
You can connect with me on Twitter at EbonyDJ _. You can connect with me on LinkedIn at EbonyDJ, and or just send me an email at ebonydj@umich.edu. So UMICH.
Awesome. Well, thank you for sharing that. And I'll be sure to link those and share that in the show notes so that if anyone is interested, they can definitely connect and reach out to you and get all that tea about the program and all the work that you're doing.
Thank you. I look forward to all the random emails.
Good. Well, thank you so much for coming on today and sharing about your experience and everything that you have done up to now. Good luck on the rest of your dissertation and finishing up your PhD program. We're looking forward to seeing where all this takes you.
Thank you. And thank you for having me on. This was fun.
Truly is my pleasure. So housekeeping items, everyone. Thank you all so much for watching and listening to this. Be sure to subscribe, whether you're watching or listening to this. That greatly helps the show get out to more people. Be sure to leave a like if you're watching this on YouTube. Leave a 5-star review on all the podcast audio platforms, and as well as share it with a friend, because that also helps get it out to people. So subscribe, review, share with a friend. Greatly appreciate you all. Peace.
Bye.